Okay, so since we now know about the blood flow in the heart, we're going to go over some vocabulary for the volume. So we're going to start up here at cardiac output. That's the amount of blood that's pumped by the heart in 1 minute. We calculate this with the stroke volume times the heart rate. And the stroke volume is the amount of blood pumped out of the left ventricle in one contraction. So it's being pumped out of this left ventricle right here. Notice how there's more muscle around that one. Then we have the heart rate, which is the amount of left ventricle contractions in 1 minute. The preload is going to be the amount of blood that refills before that next contraction. Afterload Afterload is the force required to open the aortic valve, and the ejection fraction is the amount of blood ejected versus received into the heart. So now we're going to move over to some contractility factors. That preload that we mentioned before is a huge part in that, and then the vagus nerve is going to put a brake on that. The more active the vagus nerve is, the more it's going to decrease that contractility of the heart. The Frank-Starling principle is the stretch that occurs that'll increase the intensity of that contraction, and then adrenaline will strengthen the contraction and increase that contractility.